Welcome back to a new episode of Ask the Patient Advocate podcast. Today we're tackling a difficult but very important topic: what to do when cancer treatment isn't working. This is such a critical discussion because when you or a loved one get the news that treatment isn't going as planned, it can feel, and most always feels, very devastating. But it doesn't mean that you're out of options. In fact, that is exactly when you need to just pause, reassess the situation, and make meaningful choices about your next steps. So joining me today is Christine, a member of our team. Welcome, Christine. How are you doing today?
Hi, Dr. Borrelli. I'm doing great. Thank you so much for having me here.
Of
Um,
course.
so we are getting a lot of questions actually about this, like in calls, like in comments, and even messages, like private messages in our Facebook, like all of our social medias. Like when we say a treatment isn't working, what are we really talking about?
Yeah, and that's great. That's a great question or questions. It can mean a few things. So maybe the cancer isn't shrinking or responding the way your team hoped. Maybe your symptoms are worsening or side effects are so severe they're affecting your quality of life. Sometimes it's not about failure, it's about the treatment being no longer effective or tolerable. So that moment is really scary because you're kind of thinking, okay, are we stuck? Like, is there options and things like that? But it's also an opportunity to explore new options.
That's absolutely right. So here's a question we get a lot. Is it okay to switch oncologists?
Absolutely. And I've said this, in prior podcasts as well. It's never too late to seek a second or even a third opinion. Sometimes a new provider brings a fresh perspective or has access to different treatments or clinical trials. And even if their recommendation ends up being the same, that's totally okay. That second opinion can give a peace of mind knowing that you're on the right track and that's maybe the best option or only current available option. On the flip side, you might learn something new that changes the course of your treatment for the better.